And welcome to the Crisis Jam. My name is Megan Howe.
First responders to technology innovators. Different roles, different stories, but one goal: to meet the need for crisis care and overcome the obstacles together. So join in. The Crisis Jam is starting now.
Fantastic. Wow, we have a great beginning. My name is Megan Haupt. I'm Chief of Staff with the National Association of State Mental Health Program Directors. This is Season 5, Episode 231, 231 episodes. This is A Day in the Life, Part 4, someone to follow up. We have a great lineup: Michelle Gatewood, Dr. Nina Brathwaite, and Courtney Castaneda-Cruz. So very excited that they're going to talk about their experiences in a day in the life. All right. So just some housekeeping reminders. One, just the basic rule: just stay on mute unless you're presenting and have been identified to present. You can select speaker view, which is in the upper right-hand corner. And that's instead of gallery, so you can actually see the speaker and they're spotlighted there. To join in, share your thoughts and questions in the chat box. And when we have the trivia hot seat, which is an audience question, just answer within the poll rather than the chat box. Great. Just a reminder that we have a new ASL feature, American Sign Language. If you'd like access to that, is accessible at the three dots in the bottom right that say More. When you click on that, you can choose interpretation there. Really excited. Over the 231 episodes since 2020, we've had 594 unique speakers. So if you've got an additional hot topic, something you'd like to see at the Crisis Jam, please let us know. And many of the people that are presenting today and involved today are new speakers. So we're super excited about that. You can see them in yellow, and very excited by that. And so our website, talk.crisisnow.com, not only is it there, but we also have live streaming on YouTube. So excited for that kind of new frontier that we're doing. And you can register for the Crisis Jam at talk.crisisnow.com. And we're going to have some upcoming new pieces for Season 6 related to our website as well. So, and you can see past episodes, etc. You can see kind of the categories we have that are up on YouTube if you want to go watch past episodes. So like and subscribe. We have like today, A Day in the Life. We have live and on locations. We have debates. We have fireside chats. So these are all different ways that we highlight important practices, as well as, of course, feature presentations. So Season 6 is coming in September. And so a little sneak peek on that. Very excited that on September 3rd, there will be a fireside chat with the Principal Deputy Assistant Secretary of SAMHSA, Dr. Art Kleinschmidt, who will be part of that fireside chat. Tanja Miles will be moderating that, kind of interviewing, and just really thrilled. So save that date. Dr. Kleinschmidt is just a great person to talk with. He's in recovering himself and has been very open about that. So we really appreciate his leadership. And what's really cool coming in Season 6 is September 17th, and that starts the new season of the Crisis Jam, Season 6. Senator Tina Orwell and Representative Steve Eliasson will be doing something called Battle of the Bills. Now, they're not battling with each other. They're really going to be talking about how some turnkey legislation that could really help other states Some of it's been implemented, some of it's in process, but they're going to be talking about that. And so we invite legislative partners to join and really learn about battling for better mental health. Great. And so we are really excited because the Crisis Summit we're going to be having a fourth Crisis Summit. The last one was held in Amsterdam, kind of in the Netherlands, and just international partners come along. And it's just a great community. So the crisis now, the fourth one, will be in Washington, D.C. at the Hilton National Mall, the Wharf. It'll be July 28th and July 29th, 2026. And it's going to be held in conjunction with the NASHBID annual meeting, which will be the 26th and 27th, again at the same location. So we're very excited for that partnership, and the Global Leadership Exchange is also a partner. And so, this really just talks about all of the different ways that the Crisis Summit has addressed the different locations over the years. And there have been over 500 participants from 29 countries over the years of having the crisis summits in some way. And you can see the different names that have come along. Zero Suicide, Crisis Now. So, great. And let's get to the crisis news. So this is a story about thousands of kids in mental health crisis are stuck for days in hospital emergency rooms, a study finds. And so in the past, we know that this has been happening for adults, but this story really talks about how kids lack options for treatment and are stuck in emergency rooms. And this is another story in the New York Times that says what my daughter told ChatGPT before she took her life. Just a guest essay. It's a tragic story, but an important story. And also want to highlight that in South Carolina, there's a $100 million behavioral health facility that's opening in Florence to bridge the gaps in underserved areas of South Carolina. It's a regional hub. It's inpatient, outpatient care. So really thrilled for South Carolina. We'd love for South Carolina to highlight this sometime on the Crisis Jam. All right, so let's do our Crisis Jam showdown. This is for the audience. This is where you put your answer in the poll. All right. So research shows that timely follow-up after a behavioral health crisis can significantly reduce suicide risk. According to studies, follow-up contact within how many days after discharge is associated with the largest reduction in suicide deaths. So is it within 1 day, within 7 days, within 14 days, or within 30 days? Again, what is the largest reduction in suicide deaths, the timing of follow-up? All right, so let's give that a little bit of time. And let's see. Wow. Almost a perfect split. Interesting. Within 1 day, within 7 days. So of what the audience shows, it is interesting, 14 days or 30 days. So I think the audience understands that sooner than later is important. And I think that's pretty cool. So let's take a look at the answer. So SAMHSA and multiple peer-reviewed studies have found that follow-up contact within the first 7 days, ideally within 24 to 72 hours, is linked to the greatest reduction in suicide deaths and improved engagement in ongoing care. This window is considered a high-risk period where rapid outreach can save lives. Very cool. So the answer is within 7 days, but there is kind of that qualifier, ideally within 24 to 72. Very cool. All right. So I'm going to pass this to Helen Littrell, who is with Behavioral Health Link, and to do a day in the life on someone to follow up. Go right ahead, Helen. I'll hand it to you.
Thanks, Megan. Thanks so much for the introduction, and I'm happy to be here to facilitate this conversation with three experts in the follow-up field across the country. So first off, we have Michelle Gatewood, who's the Deputy Executive Director from Contact Careline in Tennessee. And then we have Dr. Nina Brathwaite, who is the Project and Operations Manager at the University of Colorado Anschutz Medical Campus. And then we finally have Courtney Castaneda-Cruz, who is the Assistant Program Director at D.D. Hirsch Suicide Prevention Center in California. So I'm appreciative of the three of you for joining us today. And I guess first off, I'm just curious. I know follow-up is rightfully so getting a little bit more attention than it has in the past to be able to best help the people in crisis get the continuity of care that they need. And so I'd love it if you would be able to share with us a little bit more about your programs, for those of us who maybe aren't as fully aware of what your organization does. So if, I guess, Courtney, let's kick it off with you.
Of course. So thanks so much for that intro. So here at D.D. Hirsch, we actually have a wonderful and unique experience. So first I'll start, we get our referrals from two separate places. So let's start with through 988 and then through our emergency department, which ties really kind of closely with our trivia. So let's start with 988. So we get referrals through 988. We take our interactions both in 988 calls in English and in Spanish, and then we take them in chat and text, both in English and in Spanish. So we're actually able to do follow-ups in calls. So the method of calls through English and Spanish, and through text in Spanish and in English. So we're able to do the modality and language preference for our help seekers. In addition, we have partnerships with UCLA and Cedars-Sinai emergency departments. So like I said, ties perfectly with our trivia. So following someone who has been admitted to the hospital following a suicide attempt or suicidality and hospitalization, they're offered a free service for 4 to 6 weeks with our follow-up team, where they're offered a free confidential call where they're able to connect and focus on coping strategies, support services, and with a goal of linkage to services, because as we know, those following weeks, those 6 weeks or so are a high risk period for somebody to reattempt. And we do make that connection within those 7 days in order to ensure that they are getting that help and that support that they need. So that's where we get our follow-up and our referrals from. So who's making these calls? Those are our follow-up team. They're paraprofessionals with some who do have their own lived experience. Now they, when they're not taking these follow-up calls or conducting these follow-up calls through the 988 referrals or through our ED, they themselves are also conducting the calls or chats and texts both in English and in Spanish. And in terms of, thinking about how many times people are following up or answering our follow-up calls, it's interesting because the highest amount of people who respond to our follow-up calls are actually our ED follow-ups. And then those are followed by our Spanish through text and our Spanish through calls. And then are actually followed by our calls in English and then through text. So that's just to kind of give you a little snapshot of what we do here at D.D. Hirsch.
That's so interesting. Thank you so much, Courtney. We know D.D. Hirsch is such a leader in the field, and so we're grateful to have you here today to share that snapshot. We'll pass it over to Michelle, if you could tell us a little bit more about Contact Careline.
Sure, Helen. Excited to be here and represent Contact today. So we are based in Knoxville, Tennessee, and as we say in our new hire orientation, we wear many hats. So at Contact, we are a 988 Tennessee State Center for Call, Text, and Chat. We are a 988 national backup text and chat center. And then we're also one of the 988 Spanish subnetworks for those voice calls. So people that would prefer to get their crisis support in Spanish, we're one of those subnetworks that do that too. Most of our follow-up referrals are going to come from those 988 contacts across those different modalities, but we also have a reassurance program, which is for our seniors in Eastern Tennessee. And so we make follow-up calls to them on a daily basis to kind of check in on them, see how they're doing, medication reminders, and some of those referrals come from our 988 contacts as well. So we do English chat, text, or English text and call, and then we also do Spanish calls. And all of our CCs are trained on when, why, and how to offer those follow-ups in their new hire training. We want to make sure everybody knows that that's really an important service that we provide. When it comes to our staff that make those calls and texts, we actually have a specific team. It's our connections team.
I don't even know who she is, though.
Our connections team, they are trained crisis counselors. They have additional training and follow-up processes. And then we also have interns that we do crisis counselor training and connections trainings just so we can have extra capacity to meet the demand. And then for our Spanish calls, all of our Spanish counselors kind of work together. They're cross-trained, and so they take those incoming calls, and then they also do those outgoing Spanish follow-ups. For our connections expectations for that English speaking staff, they are scheduled for connections shifts. So they focus that time on conducting those scheduled follow-ups. If follow-up volume happens to be light, they might do mandatory reports or maybe take some incoming conversations. And then we are currently in the process of training the rest of our crisis counselors and weekly little mini cohorts to complete follow-ups as well. We want all of our CCs trained on everything in the follow-up process to increase utilization and then be able to meet that capacity. For our center, I think one thing that we'll probably talk about later as a challenge is that acceptance rate. So we offer follow-ups for anybody with suicidal ideation, anybody that's having thoughts of harming others, for third parties maybe that are worried about someone, or really anybody that could benefit from that follow-up call. But we really see that acceptance rate organization-wide between maybe 11 and 15%. So we're trying to do as much as we can to frame how we offer those follow-up calls and texts to get people to really understand this is a service that we're providing for them. Once we do get that acceptance, we're actually seeing only about 10% of people are answering the phone, but we are seeing 25% of the people that accept an SMS text follow-up connect in that follow-up. So the fact that people are choosing to answer that follow-up and engage in that is really encouraging to see.
Awesome. Thanks so much, Michelle, for that detail. I think you're touching definitely on what we'll get to later, but it was great also to hear a little bit more about how you're particularly making sure to help the senior folks in your community too. I'll pass it over to Nina to tell us just a little bit more about your program over in Colorado.
So our program right now has been active since September. We moved from a different provider, and so now we are at CU Anschutz. Our program is funded by CDPHE and Office of Suicide Prevention, and so initially our goal was to reduce death by suicide, other causes, and then like returning to the emergency department or inpatient stays. And so our focus really was getting our referrals from emergency departments and inpatient units. Since we've had kind of like a steady 8 or 9 months, we're moving towards expanding a little bit of our referral criteria. So it's not really limited per se to suicide ideation, an attempt, overdose, and substance use. We've kind of expanded it a little bit, especially with our youth population, to recognize that there are other risk factors for suicide. And so that's kind of exciting. Right now, we are answering our calls telephonically, and we provide follow-up calls and caring contact emails. We will be moving also to doing a text program for youth for adults starting with adults that have had more than one referral to us in a certain amount of time. Just so, maybe the caring contacts isn't working for them, and kind of upgrading what we do through a consistent text message program. We have peer and crisis professionals. Both have at least 3 years, will all have at least 3 years of crisis work or peer support work. And then they do an initial 40-hour training and ongoing professional development. We don't have expectations for a certain number of calls that they have to, do in a day. We schedule all our calls. Some are specific times, but mostly we give a little bit of a window. And when 3 of them are working, we schedule a certain number. When 2 of them are working, we schedule a certain number. Always scheduling our intakes, of course, first to get that initial connection. And then usually we provide follow-ups for usually about a month. And then if for some reason we feel like someone needs a little more, then we can always extend that. There's no real rule, but we like to really try to empower people, and in those initial few weeks, really kind of get them connected to community care if we can. Our foundation is Caring Contacts, but quickly we learned that with the state of mental health services right now, it really is helpful to provide, direct resources or referrals when we can. And so we've kind of reached out to community partners to see, are you accepting clients? Just to reduce that wall that they face when they first leave a inpatient or, emergency department.
Yeah. Thank you. It's great to hear more from the perspective, right, where follow-ups are a little bit more integrated within the hospital system compared to sort of the crisis line system. So we really appreciate that perspective as well. And I appreciate you all sharing a little bit of a snapshot of your programs. I see the chat going off a little bit. So for anyone in our audience, if you have follow-up questions, because I know a lot of information was shared by our 3 panelists, do feel free to put your questions in the chat, and our panelists will either try and get to them in chat, or if we have time to ask them here, we will as well. But I want to move to my next question is, really, we know follow-up can lead to really great things. It's such a crucial part of the crisis care continuum. And so I'm wondering if you'd be willing to share with the group a specific sort of success story that your follow-up program has had. Let's pass it back to Courtney to start us off again.
Great, thank you. I just want to highlight, I'll do 2 short ones just to highlight the difference between the ED and then on our Spanish side. So for ED, we had a 65-year-old female who was admitted to one of the ED departments that I mentioned earlier. She was experiencing bipolar disorder symptoms that were increasing, which were leading to suicide ideation. As a result, she admitted herself, and she was connected with her follow-up counselor post-discharge. And as a result, she was waiting for her psychiatrist, which was taking a while. And so during their follow-up calls, she was really focused on coping strategies, social supports with the follow-up counselor. And she really didn't know how to speak to her husband and her son about what was going on. So that's what the follow-up counselor focused on with her. As a result, towards the end of the calls where they were wrapping up, she expressed a lot of gratitude of being able to speak openly about her feelings while waiting for her psychiatrist appointment. She also stated that her panic attacks, although she was still experiencing them, were lessened. She was able to feel more present. She was able to actually name and label her emotions, even though this were just follow-up calls with our follow-up counselor. So that was one success story following our ED. And she, at the end, stated that she was not experiencing any SI following our follow-up calls. So that's one success story. And then switching to our Spanish side. This is just a general representation of the calls that we've had, just to really highlight beyond the cultural nuances of being able to speak the language, but also just as a gateway of trust for our Spanish speakers and the Latino community, that they often tell us, on the follow-up calls, like, sorry, I'm taking so much of your time, or tengo vergüenza, or meaning I have shame for having to reach out, but actually saying that this is part of the crisis care continuum, that you can get help, that someone like you is answering the phone, someone like you can follow up, and that it becomes a word of mouth for this community, my community, being able to say, like, 988 is for you. So we've had people come back and actually call 988 and say, oh, my friend, got help from you before. So we're actually seeing that impact of follow-up being supportive and actually being able to reach a community that has been difficult in the past to reach. So just another kind of general success of Spanish follow-up on text and in calls.
Mm-hmm. Thank you so much, Courtney. That is so crucial, and also sort of maybe speaks to some of the challenges that Michelle brought up earlier. But let's pass it over to Michelle to share a success story.
Yes, I actually got this from one of our Connections crisis counselors, Madison. She took the initial text, and then also did the follow-up. And so what happened was, we had a young man who was reaching out, and he had lost his job, he had left school, and there was some pretty toxic and harmful relationships that were happening in his home. And so when he reached out, he was having strong thoughts of suicide. He felt hopeless. He felt like a failure. He didn't see a purpose or direction in life. And Madison spent quite a bit of time on that text. I think most of us that do text-based support knows how long those can go. And then all of a sudden, he had to wrap up. And so Madison was able to get those pieces that we need in order to have a basic safety plan, and also offered that text follow-up. And she actually was the one who was able to complete that follow-up. When she talked to him, though, his thoughts of suicide were gone. He'd reached out to his counselor. He'd been following his safety plan, and it looks like he expanded on those pieces and just really expressed how he had hope for the future and motivation, and how much he really appreciated the support that we gave, not only in that initial contact, but also in that follow-up. I think one of the things that we are up against is building trust in the community. And we are really ambassadors for mental health and for the mental health community at large. And so being able to successfully support him in his crisis, and then honor our commitment to reach back out to him and touch base, just really, it's inspiring to see that we have the ability to make that positive impact through our follow-ups.
Mm-hmm. Definitely. Thanks so much for that example, Michelle. Over to Nina.
Yeah, so this is actually one from when we had just kind of started. We had a referral from a middle-aged man who wasn't able to figure out what was going on with him. He just knew that he was consistently, going to the emergency department, and we were able to connect him to a community partner who does assessments specifically for autism spectrum disorders. And so, a lot of times we don't hear the success stories, because they either get busy and don't answer anymore, or they got what they needed and don't answer anymore. But randomly, we got an email. He was dealing with homelessness at one point, and struggling with his child. And so we got an email, which was just like, thank you so much. Now I know what's going on with me. I know how to address it. And, I think it was definitely a boost for us starting out so early, and just having such great success with, a pretty challenging situation that he was facing.
Yeah. Definitely. No, I appreciate all three of you sharing some of the strengths that your programs and success stories have had. Being able to hear those specifics, I think, can really help with the connection to the meaningful work that you and your teams are doing, and making sure people are best able to use safety plans. People are best able to get actually connected to care, because we know that there's those waiting periods that can be incredibly challenging for people. And so I know we're nearly at time, but maybe just in sort of a 1 minute flash quick answer, if you could share with us about any sort of challenges that you've been facing within your follow-up programs or barriers that you've been able to overcome recently. Go to Courtney. Yeah.
Yes, so just being able to staff up for a course that requirement for anyone who endorses SI in the past 24 hours to offer a follow-up. So we've gotten creative, doing a lot of backup for 90-day crisis counselors who are not part of the follow-up team, ensuring they're also aware of it, which has created greater awareness and understanding amongst the team for follow-up as well. So that was my short, quick answer.
Short and sweet. Thank you, Courtney. What about Michelle?
Yeah, so I think to increase the acceptance rate and also the answer rate with those follow-ups, our connections supervisor, Josh, has started a weekly post he does called Follow Up Friday. And it just helps our crisis counselors to share different approaches to offering those follow-ups and then keeping those workflows and processes at the forefront so those are done properly. So that's really been helpful, I think, in preparing our staff to do the best we can on our end to help people see the benefit for accepting those follow-ups and then make sure that they happen properly.
Awesome. And Nina, to wrap us up, a challenge you've been
I think our main challenge was, we are a small but mighty team. So the amount of referrals that come in usually in a month is about 450. And we have 2 crisis specialists and 1 peer supporter. We are going to be increasing that number, providing peer support, but it is definitely a challenge, consistently being able to show up for 80 calls a day with the same passion and excitement. So that's been a little bit of a challenge, but we've just been working to expand our team, and it's been working out so far.
Great. Thank you so much, Nina, and we'll pass it back to Megan with a massive thank you for all of our panelists, and feel free to put more questions in the chat and we can see if they can answer them, as well as for our panelists, if you want to put your contact info in the chat and people can reach out to you and keep learning more from your wonderful expertise. But back to Megan.
Thank you so much, Helen, and the panel. How insightful. And wanted to go to Fran Lebusky Wild, who is a follow-up specialist at the University of Colorado, the Anschutz Medical Campus. So Fran, if you could please come on.
Hi, it's great to be here.
Great. If you could just give us your impressions, your takeaway, anything that you'd like to share that you gained from the panel, or your experiences.
Yeah, well, for one, it's so lovely to be here as someone who is relatively newer to the field, knowing that this national network exists, knowing that there is so much kind of thought and consideration and minds on this topic is really hopeful. Just because as a follow-up specialist, my day-to-day is fairly independent, making these calls. And so the connection is really meaningful for starters. I think something that stood out to me from the panel is this work to sort of expand who is offered follow-up services, who engages in follow-up services, and really create, I know from our end, this sort of welcoming precedent for engaging with more long-term mental health support. The experience of going through a mental health crisis, going through an emergency department, going through an inpatient stay, I think is it's one of those things that there's a lot of processing on the other side of it that can be useful. And so just kind of seeing our work as these sort of brief solution focused opportunities to welcome folks into the more longer term mental health care space. It's a privilege.
Mm-hmm. And what do you notice when, as a follow-up specialist, are you somebody that makes the direct calls?
Yeah.
Okay. When you get somebody on the phone or they respond to a text, do you do both text and calls or?
As of now, just calls.
Okay. So when you call and somebody answers, what what is that initial piece like? Oh, this is Fran, blah, blah, blah. And what
Yeah.
kind of response are you like, you really called me? I mean, like what's it like?
Yeah, I mean, it really spans kind of the spectrum of potential experiences. We have even had folks reach out to us preemptively after getting our number at the emergency department because they wanted to get connected with services right away, all the way to, reaching out to folks 3 or 4 times. Oh, I'm busy. Oh, can you call back? But when we do get folks on the phone and they're open to hearing more about us, I know that my goal is to provide kind of like clear and thorough information, but also kind of take that introductory time to just kind of like set an energetic precedence for the calls. I think it is maybe a little bit jarring sometimes, especially after going through kind of a tumultuous, like most recent few days or weeks. To then be asked to like talk about it more. So I try to come to the table with information about our services and really sort of making that first step toward connection with open-ended questions and a lot of respect for holding space for people to share what they want about their experiences and also being okay if, there are certain things that they want to keep to themselves and, again, focus on those more kind of solution-oriented resources, problem solving, that kind of thing.
And kind of meeting them where they are. You can kind of tell, do they need to talk more, or is it more about, asking, I'm just guessing a question like, well, what's gotten better since the last call? Or how are you? Or, how to meet that energy, right?
Absolutely. It's such a gift, especially going from mostly crisis support where, often I wouldn't be speaking with people more than once to follow-up support because you can start a conversation the next week with like, how did it go with your new psychiatrist? Or like, how's the job hunt? How are your kiddos? That kind of thing. Because it creates kind of like that openness and sense of rapport and trust that again, I just feel like I would always want to set a precedent for like mental health care being like a welcoming, encouraging resource for folks. And that's what I feel most excited about in like this kind of piece that I get to work on with follow-up support.
And the panel seemed to have that kind of same welcoming, encouraging, outreach, safe kind of feeling, care that feels like care, right? It's like that's the moment. It's such an important moment to really, like we're in it for the long haul, right? No, that's really great. Anything else that your takeaways from the panel, anything you want to highlight?
This has just stuck with me from this conversation and from more recent kind of community conversations around suicide prevention, but how like suicide prevention isn't just responding to folks experiencing suicidal ideation or recovering from an attempt. It's really creating an infrastructure that is there potentially before it gets to that point for a lot of people. And that's been really exciting with the kind of more expansive opportunities that follow-up services are offering.
No, wonderful. So thank you so much. There's so many questions and comments. Obviously, this is a very important piece relating to people and their humanity. You can see kind of the reactions and responses in the chat there. I do want to just give a shout out to Richard McKeon at SAMHSA, who has been just amazing in terms of underscoring the importance of follow-up. Dr. McKeon has always talked about follow-up and the importance of it, and he couldn't be on with us today, but we definitely thank Dr. McKeon for his leadership in this area and emphasizing it. Fran, thank you so much for being on with us. And thank you for your passion and your work. Thank you to the panel, and as well, Helen, for moderating the panel. You all are doing fantastic work. So thank you. So we're going to move to the next segment. Nicole Tuhig, from Vibrant Emotional Health. Could you give us some update?
Yes, I can.
Great.
Let me just.
I love your background. Look at that 988 day. You can't miss it, right? Yeah.
Yes, let me see if I can share my screen.
Sure.
Here we go.
We know you've got some videos, so we look forward to seeing those.
I do. So
Yeah.
thanks everyone for having me. And I apologize to some of my colleagues from the State Affinity Work Group I see in here who have seen this presentation before. Quick disclaimer that in this presentation, we're not reflecting the views, opinions, or policies of the Center for Mental Health Services, SAMHSA, or the U.S. Department of Health and Human Services. What is 988 Day? For those of you who are not familiar, last year was the inaugural year of 988 Day, which is our day of action, which is held on September 8th, 9/8. And our goal is really to mobilize people, individuals, organizations, businesses, really anybody to create buzz and awareness of 988. We really want to create positive momentum and awareness and explain the role it plays in our communities in mental health support. We also want to clarify that people don't need to be in suicidal crisis to reach out to 988. And we do get a lot of questions around this particular piece, especially because of the name. And a lot of people have this problem knowing, like, do I have to be in suicidal crisis? What does crisis mean? Or thinking that, like, well, I'm not in crisis, so I'm going to not call and let someone else reach out. So we really want to emphasize that 988 is there for everyone, whether you're in emotional distress, if you have alcohol or drug use problems, or even if you're just lonely, or especially for youth and young adults, if you've just had a bad day or if you're dealing with bullying, really 988 is here for you to reach out and have someone to support you. We just have a little recap video about what happened in our inaugural year. I'm hoping it'll play and that the volume will work, but if it doesn't, please just let me know.
Today is 988 Day. Happy 988 Day.
I am here today to talk about 988 Day, which is today. Hey everyone, it's Jacoby Shaddix.
And Carrie Underwood.
If you or anyone you know are struggling with mental health, help is available.
All right, I saw the note about the sound going out, and I'm not sure why that keeps happening, but I will share this link. You can watch the video in full on the 988 Lifeline's YouTube channel, but I will share that in the chat after.
Today is 988 Day.
Let me see so what are we doing this year? So this year's theme is Compassionate Help Anytime, Anywhere. And this year's theme was developed in partnership with SAMHSA and Vibrant. And then there were surveys that were sent out to both the 988 Communications and Marketing Committee, that's a part of Vibrant, and then was also shared externally with NASHBID's State Affinity Work Group. So there were feedback from multiple spaces. And then really we landed on this theme because we felt like it really conveyed what 988 is about and what we want to convey to the public, which is about, 988 here is here with our counselors to provide empathy, accessibility, and reliability. So what we have now this year is an event site and a toolkit, which is expanded from what people may have seen last year. You can find it by going to 988lifeline.org/988-day, or there's an easy to remember URL, which is 988daytoolkit.org. And what do we have available this year? So last year was really quick. I think we had about a 6 to 7 week lead time to pull together 988 days. So we've been working on this for several months. What we heard very clearly from people is they wanted the ability to co-brand some assets this year. They wanted expanded social media assets to use. And how we kind of approached this was thinking about what we called the overburdened advocate. So while 988 Day is really meant to go out into the public and for people and organizations to be creative and do their own thing with it, we also understand that many organizations are overburdened and have a lot on their plates. So we wanted to provide enough foundational pieces that people could just run with it and didn't feel that extra burden that, like, if I don't have time to create on my own, there isn't enough for me to at least like participate fully. So we have a wide variety of brand assets, different logos in different colors. We have digital content, Zoom backgrounds like you see behind me, two different kinds. We have a wide variety of social media assets, including video assets, and static display images, trusted content that we're calling things like language that can be used both for emails and newsletters, and then fact sheets for both schools, faith-based communities, and then general fact sheets. And many of these things, almost all of them, are available in both English and Spanish. And here's just a little clip of one of the video assets. So let me go to the next thing. So I don't know if anyone's had a chance to visit and see the toolkit, and if there's questions about it or questions about how you can get engaged. We do have a whole section with ideas for different populations, like if you're trying to engage in your community in person and do an activation, if you're in the faith-based community, if you're a school, but we do have different suggested ideas for what you could do and even the time period or kind of effort that it will take. But I'm happy to take any questions about what people may be looking for, or if there's extra things that you may be looking for that aren't there yet, and if we can provide that. But if there's no questions, please also feel free. I've included my name and email, and you can always email me directly.
Nicole, thank you very much. What helpful information. And, I'm even thinking how cool it is just to have things ready, just have that information ready, ready to go and share. So thank you so much for your work and for your presentation.
Yes, absolutely. I'm just trying to check the chat.
There are some questions in the chat box, so please feel free to go ahead and respond to those. I'm sure it would be helpful for folks. And we're now going to shift to Dr. Deborah Peinels from NASHBID. Dr. Peinels, please go ahead.
We got 2.5 inches.
Hello. Thanks for having me on the Crisis Jam today. It's really exciting to be here. I'm going to be talking a little bit about what we presented at the commissioners meeting back in July. Hard to believe it was already almost a month ago. But what we did was we unveiled our series of 2025 technical assistance collaboration papers that we worked with SAMHSA around. And this year is going to be about refocus and renewing. And you'll be hearing on the Crisis Jam some brief snippets from each of the topics. I'm just going to go over the topics today, and then we'll have other presentations on them. I want to thank my partner, Elizabeth Hank, who is a great assistant in collating these papers and working with me on helping editing them. So this is about moving towards health for adults with serious mental illness and youth with serious emotional disturbances. Next slide. And just to remind people, we've had this series of papers going since 2017, which we called the Beyond Bed series, really to talk about ways to think about our care continuum much broader than just inpatient beds and all the things that we need. And clearly the Crisis Jam focuses on crisis. And this year's theme focuses more on refocusing and renewing our commitments in a variety of areas for whole health. So let's go to the next slide. The idea is that given, the opportunities we have with changes, and sometimes that's scary, but sometimes it's really exciting, and we're trying to focus on ways to really think about refocusing on serious mental illness and serious emotional disturbances and renewing, just really digging in and renewing our commitment to system changes that will improve whole person health and reduce the early mortality and the negative outcomes we see with these serious conditions. Next slide. So we have a section on just the broad umbrella paper on looking at how to remove barriers towards care for looking at whole health for people with serious mental illness, adults and youth with serious emotional disturbances. And then a section on youth, which looks at what are serious emotional disturbances, how are they defined, how do we think of them, looking at functional impairments and conditions. And that's a really neat paper that's going to be coming forward. And then supportive passages for children, youth, and families to prevent their multi-system involvement. Next slide. We've got a section on adults with serious mental illness, looking at the latest on schizophrenia spectrum disorders, eating disorders, and improving maternal mental health in women with serious mental illness. Next slide. And then a section on renewing commitment to systems change by looking at a systems-based approach to supporting individuals who have experienced grief and loss, which we'll be talking about more, legal tools throughout the behavioral health care continuum, and the evolving landscape of state hospitals and public mental health systems and forensic issues in the state mental health system, all of which touch on grief, all of which touch on crisis support services that you are all doing. Next slide. So basically that is the theme of the 10 topics. And again, we'll have more opportunities to discuss those on a Crisis Jam. And with that, I'll end the NASHPIT update.
Wonderful. Thank you, Dr. Pines. And Dr. Pines has done incredible work on these papers as well as past papers. We just really appreciate your expertise, Dr. Pines, and thank you for everything that you do. We are now going to move to Arrow Foster on Pure Central.
Good morning. Can you hear me?
Yes. Great to see you.
Working. Yay. So I never cease to be amazed at the fact that I get the subject matter for these, but I don't know the content, what people are going to say. And I try to work something in that tries to hit the topics that I think are important. And every single time as I listen, I'm like, wow, these are the same topics that everybody else is talking about. And that heartens me because it means we're all moving forward with a like mindset and a like goal. So today I've chosen 3 subjects, 3 things that have to do with follow-up. And I've stacked them. I looked at what does it look like from a peer specialist point of view, and what does it look like from a stakeholder. And so the way I want to do this is to make sure that when I say peer specialist, I'm not talking about peers. I try to write it so we can distinguish between the person receiving services and the person delivering services. So for someone coming out of crisis, the biggest fear is often that once the immediate danger passes, that support's going to disappear. So follow up by a peer specialist, someone who's walked that road, creates a continuity, and that builds that trust. It helps the individual believe that they're not being abandoned by the system. For stakeholders, this matters because trust directly impacts outcomes. When people feel seen and supported, they're more likely to stay connected to services, reducing no-shows, disengagement, repeated crisis services. This means a better utilization of those resources and a stronger system credibility in the community. The second point is about creating those pathways. It's about not just averting harm. It's about pointing people towards that hope. And that follow-up allows peer specialists to link individuals to the outpatient community services, community supports, or even natural supports like family, faith communities. We know that recovery doesn't always happen within that initial episode. It can take consistent encouragement, and it can often be a winding pathway. These services are so important. And for funders and policymakers, this translates really well into system efficiency. Every time a peer specialist helps someone successfully connect to care, it means one less emergency room visit, one less repeat 911 call, one less costly inpatient stay. In other words, follow-up is a smart investment that multiplies the value of that initial crisis response. And the last piece I want to talk about is something that we've talked about here, and that's the reducing repeat crisis through that relational support. So too often, crisis systems tend to see the same names and faces over and over. We as peer specialists know from our own experiences how discouraging that cycle can feel and how powerful it is when someone checks in, not to fix you, but to walk along beside you. That kind of relational follow-up is proven to reduce those repeat crises. So, and then on the other side, for the stakeholders, commissioners, legislators, this is outcomes and accountability. Lower recidivism rates, fewer high-cost interventions, strong community stability. That all demonstrates that the dollars invested in this services are paying off. And it shows those stakeholders that the system is not just reactive, it's preventative and recovery focused. So when we think about this follow-up, it may look like a small piece on a flowchart, but in practice, it's one of the most powerful tools we have. For people in recovery, it provides the hope and stability, and for stakeholders, it strengthens the effectiveness, maximizes funding impacts, and demonstrates the return on investment. So this peer specialist-led follow-up makes the difference between a system that not only responds in the moment, but one that tries to help people recover and, my favorite word, thrive in their community. And I love that this is all being brought together in one place. So thank you so much, and back to you.
Era, what a very hopeful message, and thank you so much for bringing that home and that message home. I hear the words trust, credibility, just how important that is long-term, preventative, right? From very difficult situations if that follow-up wasn't there. So how powerful, that connection and that trust and credibility. So thank you. Thank you for that message. Great. So coming up next week, I can't believe how fast this Crisis Jam went in this hour. It's just been packed with information. I do want to just absolutely thank the panel, Nina and Michelle and Courtney and Helen and Fran. Very powerful messages. Arrow and Nicole, everybody, just an incredible Crisis Jam. And I just feel like this one really hit on care that feels like care. That follow-up is just crucial. And I love what Arrow said, that it's more than just something on a flow chart, that it is just a critical piece of helping somebody thrive in the community. And so coming up next week, episode 232 is building the crisis response. So Ted Letterman from NRI really is emphasizing the data that we have that states have done in terms of building out their crisis continuum, and who's in the process and what has been done. And a lot has been done. States have been working hard on this. So we really, really thank Ted for coming on next week. Let's look at what comes after that. Yes, the Miracle of Recovery, September 3rd at 12 noon is the fireside chat. Dr. Art Kleinschmidt will be part of the fireside chat with Tanja Miles. Tanja will be, talking with Dr. Kleinschmidt, who is the Principal Deputy Assistant Secretary of SAMHSA. Just thrilled that this is going to take place. Dr. Kleinschmidt is open about his own recovery. And so to have somebody in recovery that's also in leadership is just such a powerful thing. And so we thank Dr. Kleinschmidt for being on with us in 2 weeks. So thank you everyone for joining today. What an incredible episode. And thank you to everybody, the management, the people that organize this, and everybody have a fantastic rest of your week. Thank you.